For a lot of people, they want to live a long life, but they want to live a long life that's quality. One of the myths about palliative care early on was that palliative care was really just hospice, but with a different name. Palliative care is not equal to hospice. Palliative care, again, is for people with serious illness who may be undergoing treatment where that treatment is causing some distressing symptoms, and palliative care is really there to help out so that they continue to get that treatment. A palliative care referral can be beneficial even from the very beginning of initial diagnosis of a serious illness. There's a lot of studies out there now done over the last 20 years that really concluded that palliative care, along with the usual care for an illness, helps to increase quality of life, decrease symptom burden, maintain mobility, and in some studies, patients actually lived longer with palliative care. I've had palliative patients that I've cared for who have been on palliative care for over 5 years. So palliative care is not limited to a specific period in a person's life. It's really meant to be provided over a length of time so we can really get to know that patient and family, because the better able all of us in healthcare are able to understand what's important to someone and meet them where they are, we're able to help them navigate those decisions. With palliative care, what we're trying to do is try to meet the patient where they're at. So trying to piggyback on other appointments if possible so that the patient and family are not making extra trips. We know that quality of life measures often increase, symptom burden decreases, that caregivers feel better supported, and actually clinicians themselves in some studies have expressed feeling supported themselves and finding more meaning in the care that they are providing. Palliative care is a team approach to care. By definition, typically includes not only medicine, nursing, but social work services, spiritual care, therapies, any type of care that can be offered that may provide comfort to a patient. So we think of patient as not only the physical person and their health and well-being or illness, but their psychological well-being, their emotional well-being, and their spiritual well-being. And we try to attend to all aspects of that person, as well as their concerns for their family. One story I could share is of a gentleman who I cared for who had a serious illness, was receiving treatment for that illness, but was having some distressing symptoms. He came to our palliative care service very skeptical, not understanding what palliative care was, and was doubtful as to whether we could help him. Through the course of about a year, we helped to care for him and his family over time, focusing on his goals of maximizing his quantity of life, but not sacrificing his quality of life. And so his goals changed over time, from meeting certain dates to being able to go out in the woods with his dogs to being able to enjoy his grandchildren at home. He came to embrace our team and how well he felt the care across all of his specialists went with the inclusion of palliative care. And he actually wrote, "I thought this would be the worst trip of my life. Instead, it's turned out to be the best." For a primary care provider or a specialist who is caring for these types of individuals and families, palliative care benefits that provider because we come in as an extra layer of support. We don't take over the plan of care. We really look to that provider and ask, how can we be of help here? Providers with their extremely busy schedules don't have the necessary time to have that longer conversation. So in palliative care, we're trained to have that conversation and communicate back to the provider how this affects the plan of care. So we really hope to be an extra layer of support to provide that service that can help the patient feel like they're really getting comprehensive care. And we also try to really help with transitions of care. I would hope that when people hear the term palliative care, they feel a sigh of relief, that they feel there's extra support being offered to them, and that they are the captain of the ship. Palliative care is really there to understand which way they want to go, and if at all possible, help steer that ship in that direction. For those individuals who may have heard of palliative care and are wondering if this type of specialized care is appropriate for them or a loved one, I would recommend going to look at northcountryhealth.org and look for the palliative services there, or contact North Country Home Health and Hospice Agency, because they may be able to direct you to the appropriate care organization to help meet your needs.